Chronic pain. 3 causes and 6 solutions. Can it really be that simple? This is a problem for so many people with seemingly so few solutions. And chronic pain includes so many things. What are we dealing with here? You can have a region of muscle, bone, joint, nerve. You may not tell which tissue it's coming from. It seems to be general. Sometimes it's sharp, sometimes it's dull. It can come in so many forms, in different people and different times. Or you can have a specific muscle, bone, joint, or nerve, or even an area of the skin where it seems to be coming from. It's very specific. Or there can be other tissues that can be in chronic pain, your heart, stomach, throat. So what are we dealing with here? Mostly we're going to be focusing on people who have problems in a region. It may have started in the wrist and now it's spread to the hand and forearm. Or it could be around the knee, but it's now in the thigh or the lower back, and now it's the whole lower back. Maybe it's a little bit going down the leg. A lot of the things we'll talk about will also apply to muscle, bone, joint, nerve, and other specific tissues. But when you involve a specific tissue, there are specific treatments that need to be involved to address that one, to stop it from continuing to be damaged. So all the principles we talk about will apply to all the different tissues, but not always are exactly the same way. Chronic pain, what you haven't been told, what you have not been told, could help you. Why most treatments don't address the cause, and some make it worse. Why some pain is very persistent, and the secret door to get rid of it. Why arthritis or nerve and all chronic pain is usually misdiagnosed. And what are the 3 causes of pain and the 6 solutions for pain? Chasing symptoms is often misleading. You see the picture of the fox chasing his own tail. Here are some examples. People with chronic neck pain after whiplash have more pain throughout their entire body. So neck pain is a major issue, but they have more pain throughout their entire body than people without the neck pain. Muscular or degenerative back pain, so this is from a muscular cause or degeneration of the joints in the back, or limb pain causes changes in brain organization that seem to promote pain, and the brain function gets worse as pain persists. So we have several different areas of the body involved, several different tissues involved, going on chronically, causing changes in another tissue, the brain, which then promotes pain in the initial tissue out in the body. People with amputations may have pain in their body part that is no longer there. There's a lot involved here, and it can be confusing. Until you break it down, you know how to look for it, you know what to look for, and you know how to address it. The story of chronic pain. You may relate to this or know someone who does. You see one specialist after another, the rheumatologist, then the gastroenterologist, then the neurologist, and finally the psychologist. And from those people or from others, you may receive one medication after another, the anti-inflammatory, antacids, antibiotics, painkillers, and finally antidepressants. So what's really causing the pain feeling? Well, you have irritation or dysfunction of nerves, muscle, or vessels generating pain signals in the brain. Most often we're really dealing with nerves here. Nerves are what send information from the body to the brain to be perceived. Pain signals the brain. So here we see pain signals from the neck, others coming from the brain, ultimately telling the brain the face or the head is feeling pain. This is involved here with chronic headache. So what does pain relief cause without cause correction? Or what is pain relief giving us? What does it solve? It's merely solving the perception. It doesn't solve the problem. The pain source is usually a combination of causes. The body works as a unit, physically, chemically, and neurologically. Finding the cause and the right combination of solutions requires being thorough and well-informed. The same treatment does not work the same for everyone. Our body has astonishing complexity. It involves mental, sensory motor, chemical, relay centers, and biomechanics. And these are just portions that feed in to the pain symptom and systems. But this is just a very brief overview of a portion that feeds into it. Let's illustrate more here. This is the superficial layer of muscles, the layers most close to the skin. There's a lot of muscles and a lot of complexity involved here. If we took that layer of muscles off, you'd be left with this layer of muscles, a deeper layer. More complexity. We have ligaments and bones and muscles here. Now, when the sensory motor portion of the body is receiving information, the sensory information is sent to the brain, information is then sent back out to the body to tell it what to do. So, for example, from your elbow, you receive information up to your brain constantly. The more you move, the more information goes to your brain. But even when you're not moving, information is going to your brain. Then from your lower back, more information coming up to your brain. But not just that area of your lower back, the area of your lower back next to it. And the one next to that, and next to that. And down in your hip, information coming up, going into your spinal cord, up to your brainstem. At this point, it has not even reached your consciousness. And this is just several areas of many, many, many areas that send information to your brain. In fact, every nerve ending in your body is sending information to your brain. And at a deeper level, at a microscopic level, there are neuron connections. If these neuron connections are reinforced, that means you have learning and memory. If the connections are removed, things are forgotten. Pain connections can be reinforced. So you learn and remember pain better. You perceive pain better. You become better at it. Well, and that's good if you need to avoid something. But if there's nothing to avoid, yet you continue perceiving pain, that's bad. You want that to be forgotten. You want that nerve connection to become less efficient. So here we have a neuron sending impulses down, ultimately releasing them as neurotransmitter to the next cell. The level of complexity is dramatic. The level of potential malfunction is dramatic, but also we have all these levels where we can make changes for the better. The microscopic machinery in every cell. We have nuclear power plants and we have responsive production factories. These nuclear power plants, mitochondria, they can be damaged. The picture on the left showing oxidatively damaged mitochondria being damaged by free radicals. Essentially, we use nuclear waste, or nuclear portions, they're called electrons, and they're highly reactive. We use these to generate energy in our body. But if we don't have sufficient protection in the form of antioxidants, then we can self-destruct. And that starts in the mitochondria, the energy-producing organelle of our body. And our nucleus, the responsive production factories, they respond to all sorts of signals from the rest of our body, including our diet. The complexity is phenomenal. So it's amazing our bodies really work at all. Damage and dysfunction are inevitable. So where does damage and dysfunction come from? Essentially, there are three causes of tissue damage and dysfunction by category: physical, chemical, which may also include mental, and secondary sensitization or maladaptation. So physical, that's pretty obvious. Chemical, that's fairly obvious. Secondary sensitization, less so. We'll talk more about that later. So tissue damage and dysfunction often lead to pain. Not always, but they often do. Physical insults, chemical, and secondary sensitization lead to pain as a perception of actual or perceived tissue damage. Of course, if we have actual tissue damage, we should feel pain. If we don't, we should not. But sometimes, more often, we perceive pain when we shouldn't. This doesn't happen with everyone, but some people, especially when you get secondary sensitization, will begin perceiving pain even when it's not there. So, causes of tissue damage and dysfunction by mechanism. So we still have the categories: physical, chemical, and sensitization. Physical, of course, includes things like tissue damage, nerve damage, and tissue strain, which is biomechanical. That's something you can't see always, but you may be able to feel. Certainly as the patient you can feel it, and if the doctor's trained, they can feel it as well. They may feel it as restriction. Chemical insults include many hormonal or toxicity, including insulin and glucose levels. Some medications can be toxic, and of course heavy metals. There's also inflammatory conditions, autoimmune conditions, cerebrovascular, and nutritional, including essential fatty acids, B12, B2, and other macro and micronutrients. And secondary sensitization or maladaptation of the central nervous system, that's your brain and spinal cord, or the peripheral, the nerves out in the rest of your body, and the connections between nerves, where those chemicals go from one neuron to the next. So it can be a neuron itself can be sensitized, the synapse, where the neurons connect, or reorganization or imbalance of connections. The pathway becomes more efficient. So what happens when a tissue is damaged or insulted, physically or chemically? Well, often there's acute or short-term pain, and the expected healing time frame can be as short as days or weeks, and certainly usually within 3 to 4 months the tissue is as well as it's going to get. So during that time you have normal or abnormal tissue healing. If it's normal, you have normal adaptation, no pain, the tissue works well. If it's incomplete, you have maladaptation, chronic pain, and perhaps secondary sensitization. Pain is a perception of damage, whether it's sudden and severe, often requiring urgent care, or gradual, insidious, or persistent, with no urgent care options. The ones that are covered up in gray here, those are the sudden and severe ones typically. And the other ones left over, what do you do with these? There are no urgent care options. Medications and surgery typically are not helpful. They may cover up the pain a bit, but they're not going to address the cause. Well, our body's amazingly resilient. Muscles and joints recover, nerves rebuild, the brain readapts. The body heals itself frequently. This is wonderful, even after a long time, if the body's healing is properly supported. Now, why don't we hear about this as a solution for chronic pain? Well, there's a barrier of understanding between urgent care need and health and wellness needs. Urgent care, medications, and surgery. On the other side, diet, lifestyle, manual therapies,